My name is Dr. Gerald Bilsky, but I go by Jerry to most people. And I am a physiatrist here at Shepherd Center, which is a specialty dealing with rehabilitation medicine. I went to college at Brown University and did my medical school and residency training at the University of Rochester in Rochester, New York. I chose to become a doctor because I really had the ambition to help people. I grew up in an era where it was one of the most noble things you could do, and I really felt like I had the skill set and the passion to do that. During my first year in medical school, I spent the summer on a spinal cord rehabilitation unit in Rochester, New York, and not only was it a blast for me, but it allowed me to see patients and get to know patients longitudinally, get to spend a lot of time with them. So that was very appealing to me. I've been at Shepherd Center for over 21 years now, and it was almost a fluke for me because I was a solo practice physician in town and ran into Dr. Leslie, the previous medical director, and he and I were talking. We'd known each other for a number of years, and he needed help here at Shepherd Center and convinced me to join him here. I've transitioned to a part-time position, and now my responsibilities are to help cover for inpatient physicians that are on vacation to provide that kind of coverage. I have a lot of opinions and philosophies about taking care of patients. I think first and foremost, we have to do what is right. That doesn't always make people happy because sometimes doing what's right is not always popular. But I believe strongly in doing what's right and looking out for patients for the long haul. It is not a short-term issue that we deal with. And we have to be creative as well. Shepherd is quite unique. There's a milieu and an ambiance around here that's very positive and upbeat, which you don't see in a lot of places. In addition, there's a lot of services that we try to provide that are outside of the standard services provided by most rehabilitation hospitals. An example would be our recreation therapy department, which is unique and supported by the community. You don't see those kinds of activities provided in most rehabilitation hospitals. The best piece of advice I could give is probably twofold. One is to be open. We know that patients and families are struggling and dealing with serious things. They may also have preconceived notions about what should happen. I would tell people to be open to listening to what the experts have to say, number one, and number two is kind of trust the process. There's a method to the madness, and we have their best interest at heart. There are a few things that stick out in my mind and remind me about why I do this. And I think the first one was the first time I got invited to a wedding from a former patient. And that really stuck with me. And there have been several weddings, graduations, those milestones that former patients achieve, and they felt strongly enough to reach out to me to be a part of their celebration. That really hits home. I hope to be remembered for someone who was honest, hardworking, felt strongly about doing what was right, and cared. I think if I can be remembered for those things, it will have been a successful career.